The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello, I'm Dr. Emerson, Medical Director at Eden Valley Lifestyle Center. I've come to finish up our topic of obesity, weight control, and we find that it is part of the insulin resistance syndrome. As you recall, we mentioned at the beginning of our series that we were going to look at a group of people who are actually no more active than the average American office worker. They eat 30% more calories than we do, and they weigh 20% less than we do. This group of people was analyzed in one of the largest epidemiological studies in the history of the world, and we're going to look at what their secret was and how they were able to eat more and actually weigh less. In our series thus far, we found that low-calorie diets do not work and will actually result in a weight increase. We found that as soon as you go on a low-calorie diet, your body responds by turning down the metabolism, by turning down the thermostat. Body temperature drops, pulse rate drops, blood pressure drops, oxygen consumption drops, CO2 production drops, heat loss drops, activity level drops. Everything is done to conserve calories. Your body is adapting to the low-calorie situation. When you come off the diet, the body is now in a mode to get ready for the next starvation period. So what it does is it increases metabolism a little bit, but keeps it below what it was before the fast. It increases the muscle mass a little bit toward normal, but still keeps it below what it was before the previous fast, so that there's less muscle to feed in the next starvation period. And it increases the body fat higher than what it was before the previous fast, so that there is actually a body fat gain. And this is so that during the next starvation period you have more fat to feed, less muscle with, and you have a lower metabolism so that you can get through the next starvation period. We found that countries that go through annual starvations where the crops run out before the next crops come in, when the crops come in they become obese. When the crops run out, they become very thin, low muscle mass, and this is how they get through the starvation period. So we've seen that low-calorie diets in the long run will actually cause you to gain weight. And so we want to avoid those problems. We looked at some studies done with the Atkins diet, the Weight Watchers diet, found that they're not the ideal diet for weight loss in the majority of cases. We also looked at exercise. If starvation, weight loss is not successful with starvation, what about exercise? Maybe we can just exercise people enough to achieve ideal body weight. What we found is that our body works in two phases. We can have a sedentary form of existence where there is an increase in weight, but when we move into the moderate exercise activity level, the body weight will come down. But as we move further into the more activity level, there is a plateau beyond which there's no further weight loss. This was first shown in rats, and then it was shown in mill workers in India. So yes, we do encourage patients to be active, but again, there is a limit to what activity can do in terms of controlling weight. And then we looked at the real cause of obesity in America, which is the insulin resistance syndrome. Insulin resistance syndrome is rampant now. 1 out of 4 Americans today qualifies for having this. And what the insulin resistance includes is, again, high blood pressure, high blood sugars, a high weight, a high LDL, a low HDL, high triglycerides. These are parts of the insulin resistance syndrome. Why does the insulin resistance syndrome cause an increase in weight? Well, again, when you take in a sugar or a starch, your blood sugar rises. The pancreas senses that, releases insulin. Insulin's a little key that goes in the cells, opens the doors. Sugar leaves the blood, goes in the cells, and gets burned, and that brings your blood sugar down. That's the way it's supposed to work. When you eat the animal products, the meat, dairies, the oils, those fats go in and plug up the insulin receptors, those little keyholes. So now when you take a sugar or a starch, blood sugar goes up, insulin released, can't get in the keyholes, the doors stay shut, blood sugars rise. That's insulin resistance. How does this cause obesity? Well, as your insulin resistance rises over 10 or 12 years prior to the diagnosis of diabetes, the body just compensates. The pancreas compensates by releasing more insulin to overcome the insulin resistance and keep your blood sugars under control. Over those 10 or 12 years, insulin resistance increases. The insulin levels in your body increase in response to the pancreas releasing more insulin. The blood sugars stay under control. But at the end of 10 or 12 years, the pancreas cannot keep up with the increasing insulin resistance. And so now the blood sugars start to rise, and doctor diagnoses you with diabetes. During that 10 or 12 years, as the insulin levels are rising to compensate for the insulin resistance, that insulin not only drives sugar into the cells to be burned, does not only drive sugar into the liver to be stored, but it drives fat into the fat cells to be stored, and it prevents fat from being burned. This results in an increase in weight during those 10 or 12 years prior to the diagnosis of diabetes. When you're diagnosed with diabetes, doctor many times will say, well, you have diabetes and it's because you're too heavy. Actually, what's happening is you're too heavy because of the insulin resistance, which is causing both diabetes and the increase in insulin and the increase in weight. Well, if this is true, if insulin resistance is the core problem with the epidemic of obesity we have today, then we would expect that moving to foods that decrease insulin resistance should have an effect of decreasing our weight, lowering our weight. We have actually found this to be the case. Many patients who will shift to a plant-based diet will lose about 2 pounds per week. Well, what are the foods that can help us decrease? In review, we find that monounsaturated fats in the olive can be very helpful. We encourage patients to get the olive oil in the olive as it's found in nature. Polyunsaturated fats found in safflower oil, sunflower oil, corn oil, soybean oil. Again, we encourage you to get those oils in the natural forms, in the soybeans and in the corn. The fiber in the corn and in the plant foods can also help lower insulin resistance. Whole grains have been found to help prevent the incidence or occurrence of diabetes, most likely from the phytochemicals in the whole grains. They found that this effect was independent of their fiber content. The foods that you want to avoid that cause insulin resistance include the saturated fats found mainly in the flesh foods and the dairy products. Unfortunately, even the white meats, chicken, fish can cause increase in insulin resistance. So the ideal program is to eliminate the animal products totally. Trans fats are probably the worst fats in terms of insulin resistance. And those are found in margarines. Those are found in shortenings. Many of the fats used for frying have partially hydrogenated fats in them. And if anything says partially hydrogenated fat in them, those are the trans fats, and you want to avoid those. Also, vegetable oils and marine oils that are formed from hydrogenation or partial hydrogenation are also trans fats. And milk, butter, and beef, 5% of the fats found in those products are also trans fats. It's also been found that a high cholesterol level is correlated with insulin resistance as well. So we want to avoid foods with cholesterol. Well, the question naturally follows is, are there any actual studies that show that people on a plant-based diet really do indeed have lower body mass index, which is the measure of obesity? Yes. We want to look at the EPIC Oxford study. This was a very large study. 37,875 subjects were tested in this diet. They looked at their different dietary habits, and they classified them in 4 different groups, both men and women. And what they found that the omnivores, the people who ate the meat products, the dairy products, and the plant products as well, that they had the highest body mass index, both in the men and in the women. Now, if these people gave up the red meats, the poultry, and just ate chicken and dairy, what they found was that the weight did indeed decrease. If they were just eating the fish, the dairy, and the plant products, the weight dropped significantly and the body mass index dropped. So that was a step in the right direction. The next group not only eliminated the meat products, but also eliminated all fish products, but they continued to eat the dairy products. When you eliminated the fish and you stayed with the dairy, there was no further drop in weight. This did not improve the lower weight, the ability to lose weight. Then they went to the next group, and the next group took the next step, and that was they eliminated their dairy products as well. So they had no flesh foods and no dairy products, and that's where we saw another weight drop. Body mass index dropped significantly again. The factors that tied most closely with the high body mass index, or the higher weights, were a low fiber diet and a high protein diet. Were there any journals or articles that explain obesity in these terms? And actually there are. An article in Medical Hypothesis back in March 1st, 2000. I had an interesting article, and it expressed this concept. Quoting from it, less saturated and trans fat intake decreases insulin resistance. This decreases the amount of insulin needed to be released. Insulin acts to impede fat burning, that is oxidation, and promotes fat storage, end quote. So they're expressing the same concept, that when you have insulin resistance, your body has to produce more insulin to combat the insulin resistance, and this extra insulin drives fat into the fat cells, prevents fat from being stored, and produces the increased weight and the massive epidemic of obesity we see in America. The author concludes, again quoting, minimizing diurnal insulin secretion in the context of a low-fat intake may represent an effective strategy for achieving and maintaining leanness. So, these concepts are current in the medical literature today, and we have found by experience that it's very effective. Another article came out in Obesity Research, March 1st, year 2000, and they wanted to find out, well, how easy is it to stay on a vegetarian diet versus, say, a low-calorie diet? Well, when they surveyed a lot of people on these different diets, they found that those on a low-calorie diet were able to maintain it for on the average of 1 to 3 months before they gave up and said, I can't tolerate this anymore. Vegetarians, on the other hand, stayed on the diet well over a year without any difficulties in this survey. It was much better tolerated, and there are many nations of the world today that are on vegetarian diets. They've been on that for a lifetime, and they're doing very well. The reasons for stopping a vegetarian diet were assessed, and they found that on the low-calorie diet, 53% of the people listed boredom as a reason for stopping the diet. On the other hand, the vegetarian diet, only 5% listed boredom as a reason for stopping. Are there any other studies showing a vegetarian diet or a vegan diet to be helpful? And now we come to the Grand Prix of epidemiological studies called the China Study. This was authored by T. Colin Campbell, PhD. He wrote the book called the China Study. It's a New York Times bestseller book, and it is very readable, and it's one of the best books that you can read at this time to get an overview of the current studies showing the benefits of a plant-based diet. This was the most comprehensive large study ever undertaken of the relationship between diet and the risk of developing disease. That's a quote from New York Times. New York Times further said about this book, the findings, quote, are challenging much of American dietary dogma. Now, what is the dogma that it's challenging? What it's challenging is the concept that in order to lose weight, you have to either decrease your calorie intake or increase your activity level. The reason it's challenging this is because they found a group that was doing neither of these things and yet had a much lower body mass index than we have in America. How did they find this? What did they do? Well, quoting from the China Study again, quote, we ranked the Chinese into 5 groups according to their levels of physical activity. After figuring out the calorie intakes of the least active Chinese, the equivalent of an office worker in the United States, we then compared their calorie intake to the average American. What we found was astonishing. That was a quote from T. Colin Campbell in his book. Well, what were the results? Well, what they found was that they looked at the Chinese who were the least active, the bottom 20%. They found that those Chinese were about 20% less in terms of their body mass index compared to an office worker in the United States. So you have a group of people that was no more active than an office worker in the United States, and yet they weighed 20% less than the office worker in the United States. So you might be tempted to think, well, it must be because they're starving them in China. So they measured the calorie intake, and what they found was that the Chinese were eating 30% more calories than their American counterparts, were no more active than the Americans, and yet weighed 20% less. This was what he found as astonishing. Well, they had to find out why, and they looked at why the Chinese could eat more, weigh less, and be no more active. What they found was that the Chinese, their animal protein intake was only 0.8% of their calories, whereas in the United States, protein constituted 10 to 11% of their calories. We find that the protein intake for vegetarians tends to be less, and yet strength and endurance, in another talk we find, is actually increased. They found that their intake from the animal proteins was much less, indicating that they were basically vegans or very close to vegans. Their fat intake was also much less. Chinese were eating only 14.5% of their calories from fats. In the United States, it was ranging 34 to 38% of their calories from fats. So what they were doing was the Chinese were basically on a plant-based diet, and this prevented the insulin resistance, allowed lower insulin levels, and allowed a lower weight. And this is why they were able to accomplish what they did without having to cut their calories or increase their activity levels. Well, there was a fellow who read an article that most motor vehicle accidents happen in a radius of 30 miles of home. So he moved. Now, of course, we know that wouldn't solve his problem. The question is, do we have to move to China to lose weight? No, we don't. We can actually eat like the Chinese do here in America by making proper choices and gain the benefits that they gain. We can actually eat 30% more and weigh 20% less. One of the physicians at hospital I work at, he would look at some of the vegetarian physicians and be almost frustrated because he would say, you know, they come out with their plates piled high with all these plant foods. It looks like a huge amount, and yet they're all slim. And I explained this to him and tried to explain how that's possible. So, in review, we find that you can lose weight by just shifting to a plant-based diet. You don't have to do a calorie restriction. Exercise is important, but it's not the ultimate solution. This was illustrated in a story about Tony we talked about in the diabetes talk. She was a lady who came to us who weighed 325 pounds. She was 5'3". She rolled into the office in a wheelchair. She rolled in because she was heavier than she could lift. Unfortunately, she had diabetes. She was blind from her diabetes. She had hypertension. She had high cholesterol levels. And these were all serious problems that she needed correcting. She was on medications for her high cholesterol. She was on medications for her diabetes, 44 units of insulin. She was on medications for her blood pressure, 2 different medications, as well as a water pill to help get rid of the excess fluid in her lower extremities. I went through what we've explained in diabetes and in hypertension and in obesity, the benefits that could be achieved on a plant-based diet. She followed these programs, she followed the methods, and even in a wheelchair, without any exercise to speak of, she just made the shift from her regular diet to a plant-based diet, no calorie restriction, and she lost on the average of 1 pound a week. Within 2 months, she was off of her blood pressure medicines. Within a year, she was off of her cholesterol medicines with no significant rise in her cholesterol, and we were able to switch her from insulin to oral medications for diabetes at the end of a year. At the end of 2 years, she'd gone from, she had lost about 1 pound a week, and she was now, had lost over 100 pounds. She saw her surgeon, orthopedic surgeon, and he was able to replace her knee and allow her to start walking again. And as long as she stayed on that program, she was able to maintain her weight, maintain her blood pressure, and her cholesterol. If she got off the program, she started seeing her weight increasing, blood pressure increasing, cholesterol increasing, and was then reminded again that she needed to get back on the program. So we have seen this in not just her, she's a more specific example, but we've seen it in the majority of our patients who have problems with weight who make the shift to plant-based programs. There are other approaches which I don't recommend. They're question of bariatric surgery. Personal experience with bariatric surgeries with patients that we've worked with, that many of them have serious complications following the surgery. Surgery basically will take part of the intestine and bypass that intestine so that the food goes from the stomach to a distal part of the intestine so that it is not able to be absorbed. And you're essentially putting a person in a chronic starvation cycle. And this does cause weight loss initially, but it also causes nutrients deficiencies as well and may contribute to the complications of bariatric surgery. Following surgery, of course, you don't have the nutrient intake, and it's harder to heal as well. They found that the weight loss is in general about 1 to 2 pounds a week with bariatric surgery, but again, this is what we find with a plant-based diet as well, and that's achievable without the surgery. So I'd encourage those that if they're considering bariatric surgery to at least give a plant-based diet a try first. It doesn't have any significant complications, and you can avoid the possible complications from surgery. I would encourage you to go over the pros and cons with your doctor, the possible complications as well, and the outcomes following bariatric surgery. I did have one patient in practice who came to us because she had bariatric surgery and now she was having to eat constantly to maintain a weight above 90. She had severe nutritional deficiencies and it was very difficult for her to maintain her weight now. Others where the results were so-so, and out of about 5 patients we've seen, we had one that had a good result. Okay. The National Institute of Health does recommend that for anyone considering bariatric surgery that they be well informed of the pros and cons, possible complications. They need a body mass index of over 40. They need to be an acceptable surgical risk, and they need to have failed non-surgical approach prior to this. And I would again stress plant-based diet as an attempt before considering the surgical approach. Also, we need to remember that once bariatric surgery is done, bypass surgery being done, the patient is required to be on long-term vitamin supplements for life because they are not able to absorb the nutrients the way they could be prior to the surgery. So, in review, we found that low-calorie diets don't work. They cause weight gain in the long run. They're tolerated poorly and are not successful in the long term. Starvation studies in the past again showed that when people come out of starvation, they respond with a weight gain and a decrease in metabolism, higher body fat, less muscle mass. And these are things generally we want to avoid. Atkins diet, long term again, is poorly tolerated and again works on the low calorie approach. Weight Watchers has a similar approach, step in the right direction, it's lower in fat, but again, low calorie diets will long term react with a weight gain. So I encourage you to again move to a plant-based diet. This can lower your insulin resistance. Get on a moderate exercise program. Walking has been statistically shown to be the best. This decreases body fat, not muscle. And you can lose weight. You can control your blood sugars with a plant-based diet. You can maintain your health. This has been verified in the China study and in the Oxford EPIC studies. You can choose a plan outlined in God's Word about the plant-based diet that was originally introduced in the Garden of Eden. It was good for them and it can be good for you. I wish you God's blessing and His health. Thank you.